Welcome back. This is National Infertility Awareness Week, and you may not know this, but this is an issue that actually affects 1 in 6 people in this country. Joining me now is Dr. Abigail Mancuso. She's with the University of Iowa, a professor of reproductive endocrinology and infertility. You're based out of the university's West Des Moines Clinic.
That's correct.
Thanks for being here.
Yeah, thanks for having me.
That is a really super long title. Bottom line, you help people start their families.
That's correct, yes. It's a very rewarding career.
Yeah, tell us a little bit about that side of it, the reward.
We work with some of the most amazing patients, for one, and I think that there's nothing more rewarding than helping somebody become a parent and have children and everything. So we get to help people with some of their hardest times and stuff, and hopefully get them to that point where they can have some of their greatest joy. So
yeah, I know last year during Infertility Awareness Week, I posted 1 in 7. Well, now we're seeing that change to 1 in 6. So just tell people, how common is infertility?
yeah, so recent data suggests that 1 in 6 people will struggle with infertility during their lifetime. So it does seem to become even more common as time has gone on and everything, and extremely common. If you think of 1 in 6 people, how common that is.
Yep. So having been through this myself, what do you advise people when it comes to seeking more advanced help? You know, when should people go beyond just their OBGYN or their general practitioner?
I would tell people that they should seek care whenever they think that they should. You know, I think a lot of times people say, well, you know, technically you should be trying for 1 year before you should seek help. But if there's something going on, you're not having regular menstrual cycles, or there's something else that's making you worried, then you should just seek help at any time. I've even seen people before they even started trying that were just curious about their own fertility, and I'm happy to see people even before they've started trying. So at any point, if someone's worried, I would advise them to seek care from a professional.
Do people need a referral to come see you?
Nope, they can actually just call and schedule an appointment.
Okay, wonderful. And you guys are located, it's the Jordan Creek area.
That's correct, yep, in West Des Moines.
Okay, and that's relatively new because the University of Iowa used to be, I had to go to Iowa City for treatment.
Yes. Yeah, so we had a lot of patients that were driving from the Des Moines area to Iowa City, and as you know, there's a lot of like ultrasound monitoring and things, so it involves multiple visits, and they were driving that 2-hour round trip, you know, 4-hour round trip really,
Right.
for everything. And so now they can get a majority of their care in West Des Moines and then just maybe go to Iowa City for a few things.
Which is fantastic. So the first IVF baby was born in 1978, which is incredible to think about. How has treatment changed over the years?
Yeah, so for one, there's been increasing utilization of IVF. You know, insurance coverage still is nowhere near what it should be for IVF coverage, but it is getting better, which has really increased access to that excellent treatment. Treatment's gotten a lot better over the years. And then patients are doing IVF for more different reasons. Now we're seeing a lot more patients for fertility preservation. We see patients that are doing genetic testing on embryos to prevent passing down genetic conditions. So there's just more and more IVF now than there used to be, and it's getting a lot more successful than it was.
So I think what we're seeing now are some of the pictures from my friend and colleague, Stephanie Moore, former colleague. She worked here at Channel 13 a number of years ago. She was in earlier this week talking about their success story through the University of Iowa. She and her husband tried, I think she said 4 years. This was their second child, their first. They didn't need to go through infertility treatment. It can be so disheartening for people to go through this year after year, cycle after cycle. What advice do you give people?
I think the best advice is just to find a good community, a good support system there, because, you know, I think when patients are going through infertility, they often tell me, you know, all they see is their friends and family just getting pregnant. Everywhere they go, they're pregnant people, but it's very common, as we discussed. So I think finding a good support system, people that are going through the same thing as you, and really, you know, gaining support and stuff, and knowing that there are other people going through what you're going through.
Absolutely. All right. We so appreciate your work and your insight today.
Yeah, of course. Yeah, thank you so much for having me and for increasing awareness.
Yeah, of course. Janae, we'll send it back to you.